Most people finally enter the mitochondrial health conversation after they're already tired and burnt out. This video is for understanding a different moment, when your labs still look reasonable, when nothing has been named yet in terms of disease or diagnosis, but something in your health history still isn't adding up. Mitochondrial dysfunction doesn't announce itself until it does, and it builds over time. And by the time a diagnosis in your health reflects it, the process has likely been running for a while. I'm Dr. Kenny, root cause health detective and IFM certified functional medicine practitioner. And in this video, we're going to look at what that earlier window actually looks like and why standard diagnostic tests tend to miss early mitochondrial dysfunction altogether. In our conventional health reality, we tend to look at the moment a disease gets named as the official diagnostic timeline. The day the diagnosis lands, the first time a lab value comes back in the red, for instance, that's where most people's understanding of something going wrong begins. But from a systems-based functional medicine perspective, that moment is almost always late in the story. The process that leads to diagnosis across almost every chronic disease starts way earlier, sometimes years or even decades before we actually reach a diagnosis. And mitochondrial dysfunction is one of the clearest examples of this. The research literature actually describes it in terms that functional medicine has been using for quite a while, that abnormalities in the way your little cellular engines, your mitochondrial function, especially in your skeletal muscle, show up consistently in people who are insulin resistant, meaning that their cells are losing the ability to respond to the hormone that controls blood sugar. And this includes high-risk individuals who haven't even crossed the threshold into type 2 diabetes. So this is showing up long before the world of diagnosis. What this means in practice is that there is a long stretch of road between normal and diagnosed conditions. And functional markers, lab tests that are designed to measure how the body systems are functioning on a spectrum of function to dysfunction, rather than just definition-based diagnostic ranges, which most of our blood labs are designed around, can begin to map out that territory before your threshold is crossed into disease. And that's what this video is all about, understanding this fundamental difference, especially as it relates to mitochondrial health. Now, before we do go further, I want to name something that gets missed all the time. A normal metabolic panel, which is a very standard blood panel that you run in and get with your yearly checkups or similar, is not the same thing that confirms mitochondrial dysfunction is not present. Those are two very different questions, and that standard blood panel wasn't designed to answer the second question about mitochondrial health. Your CMP, or comprehensive metabolic panel, tells you something about your blood glucose, your kidney enzymes, and your liver enzymes. It tells you whether certain thresholds have been crossed, usually into the realm of defined and diagnosable disease. What it doesn't tell you is how efficiently your cells are actually generating energy in your mitochondria from the fuel that you are giving them. Those are very different levels of investigation. And this surprises a lot of people who are told most of their life that their labs look normal until they don't all of a sudden, and they're wondering, well, what happened in that moment? Again, go back years to decades, and likely the process had been running for a long time. In fact, recent statistics suggest that up to 93% of Americans are metabolically unhealthy, and it's not because they have abnormal CMPs a lot of the time. And if there's anything you take away from this particular video, it's this, because this distinction is the core of what I want you to understand when it comes to conventional lines of questioning versus functional lines of questioning. Standard labs are designed to catch fires once the house is already burning. That is what they were built for. Let's define disease states and catch them when we can. What we're talking about today is something fundamentally earlier, reading the smoke signals, if you will, or getting your wiring checked out well before your smoke alarm has to go off. So let's turn our attention to the mitochondria, just in case you're coming across this concept for the first time. What do your mitochondria actually do, and why does a decline in their function matter before anything becomes diagnosable? You can think of mitochondria this way. Imagine a car that still gets started every morning, still gets you to where you're going, but the engine itself is running less efficiency than it was 2 years ago. Nothing is broken in a way that would show up on a standard inspection. Your mechanic might not flag something that's going on underneath, but something is different in those 2 years since you got it, and has been for a while. That's a rough picture of what mitochondrial function decline looks like in real life. You're still functioning and able to power through, and even your labs still look normal in a conventional sense. But underneath your cells, which run on ATP, this is the fuel that is produced by the nutrients you eat inside of your mitochondria, that conversion may be becoming less efficient. And that inefficiency has the downstream consequences, and they show up in diagnostic labels years, decades down the road, whether we're talking about blood sugar dysfunction, heart health concerns, even some cancers. And when it comes to mitochondrial energy production, the chemistry is pretty complex. Your mitochondria create energy through a process called oxidative phosphorylation. And that first part is really important. If you've ever heard of oxidation or oxidative stress, or maybe even antioxidants, you've tuned in to this particular conversation already. Oxidation is essentially the browning of an apple that occurs in our own bodies. And in fact, our own energy production is one of the greatest sources of oxidative stress, kind of an irony. The difference between that browning apple and our bodies is that we have living antioxidant mechanisms to combat that oxidative stress. But what happens oftentimes with mitochondrial inefficiency and our lived health experiences is that oxidative stress starts to tip the scale. And you'll notice most chronic illnesses that plague our society today have a basis in uncontrolled oxidative stress. In a normal, healthy cell, when running through this process, our mitochondria produce about 30 to 36 units of ATP or energy per glucose or sugar molecule that we consume. When that process starts to degrade, however, or there are roadblocks that are occurring in your chemistry due to uncontrolled oxidative stress, micronutrient quality, the cells shift more toward backup in your energy production. In more extreme cases, cells can actually shift toward a less efficient energy creation route called glycolysis. And this is basically burning glucose quickly for a much smaller energy output. You only get about 2 ATP per glucose molecule going this pathway. So this sometimes explains people's profound fatigue and difficulty switching into healing mode when your body's producing 2 ATP compared to 30 or 36 per glucose molecule. And that's where sometimes the food to energy ratio, there's a huge mismatch. You could be eating the exact same things, but generating so much less energy compared to somebody else with mitochondria that are functioning and supporting them. This shift in energy production is not theoretical. It's the same exact metabolic pattern that was actually described in research by Otto Warburg in the 1920s when he was looking at cancer cells. This is what has created what's now called the Warburg effect. And essentially, these cancer cells are choosing an inefficient energy creation mechanism over more high efficiency energy creation pathways. And current research supports this further that shows that cancer cells strongly increase glucose uptake, and they drive a wedge between the more efficient energy creation processes. Of course, this energy creation is very important for health and healing and longevity and getting over the humps of many of our chronic health conditions. And by the way, if you're one who likes the research, I've put together a free research summary that includes some of the studies that I've cited in this particular video. So check it out. It includes my take as well as some practical takeaways in addition to the research citations themselves. And just know that I'm not bringing up cancer in this context to create some kind of alarm, but rather to educate you on some of these deeper mechanisms going on underneath. I'm using it because it is one of the clearest illustrations that we have of what happens at the cellular level when the efficiency of your mitochondria degrades. And because it helps make visible something that is otherwise very easy to miss, because many times you're not experiencing symptoms that drive you to the doctor in the earlier stages. And it's important to understand that mitochondria are in every cell of our bodies. So the shift from efficient to inefficient energy production is not just an oncology or a cancer pattern. This is a metabolic problem. So where does mitochondrial dysfunction show up clinically even before you have a diagnosis? The spectrum of experiences is quite large. Here's a pattern that I see regularly. Someone may be in their late 30s, late 40s, not black and white. They've done everything right between diet and movement, and yet their cellular response, or just the way they feel their body is creating energy, is not matching the inputs the way that they used to. They may not be hitting those exhausted energy or burnout walls yet, although they absolutely can as well without a diagnosis in the conventional paradigm. But this is the most common undertone that I see. And when we realize that mitochondria are responding to the rest of the signals in our body, this can make a lot of sense. So if you are not recovering from exercise the same way you used to, or maybe your mental clarity is inconsistent, maybe not to the point of brain fog, but it absolutely can. Again, it's a spectrum of experiences. This speaks to your little cellular engines not running as efficiently more often than not. And sometimes tuning into the body to that level of honesty and specificity is something that is very difficult in our society. People are generally told to push harder or drink another cup of coffee, add another lever or a new supplement, and the needle just doesn't move the same way that it used to. Or it's the proverbial, I'm just getting older conversation that stops the conversation right there. When a patient's conventional labs come back normal too, it further solidifies the depth of this confusion, this mismatch between the way I feel I should operate and what's actually happening in real life. That's a gap that conventional diagnostic tools were not designed to solve. And this gets missed even in integrative settings as well. The conversation tends to jump on what do we add first, which supplements support mitochondrial function, which approaches address the fatigue more directly. Do you need some glutathione or extra B12 in an IV form? But honestly, before that conversation even makes sense, there is a prior question to more deeply understand. What is the current state of my cellular energy production in my cells? And what's underneath that state even? What's driving that further? Before we jump to adding something, we have to ask a better question to understand what is driving that to begin with. Now, the research in humans on the relationship between the way your mitochondria are functioning and metabolic diseases like diabetes and prediabetes, or high cholesterol, or obesity, is honest about something that I think is worth being equally honest about here. The causal direction is genuinely uncertain. It's important to understand the limitations of our current research. But multiple reviews of human data have concluded that decreased mitochondrial energy production through that more efficient energy pathway that we talked about appears to be an early feature of insulin-resistant states. And insulin resistance also characterizes most of the conditions I just mentioned above. But whether that dysfunction is the initiating cause or an adaptation to earlier metabolic changes elsewhere that we haven't fully explored yet, but what the evidence does consistently show is a strong association between impaired or reduced mitochondrial energy output, especially in skeletal muscle, and insulin resistance. And this is present in both individuals with or without type 2 diabetes and in high-risk individuals who haven't been diagnosed yet. Considering 93% of the US population is metabolically unhealthy, this is probably something going on underneath many of us. This research is also linked to in the free research summary in the pinned comment and the description below, so check it out. What this means for deeper clinical and functional medicine thinking is that these associations appear early on. There's this gray zone before a diagnosis exists for a long time. Whether the mitochondria are driving that decline or adapting to it, they are still a part of the picture. And the metabolic consequences and just your quality of life of that impairment accumulate the longer we just write them off as normal. That's the interpretation gap, and that space between what a standard conventional lab test shows and what the patient is actually experiencing underneath, whether you perceive it or not. In a good functional investigation, that's often the most important territory to get some understanding in. So I'm curious if you've ever been told that your labs are normal, but something still felt off. What did your doctor say when you tried to describe it to them or clarify what you're experiencing? Drop it in the comments. I read every one of them, and it's great to see the variety of stories, very helpful for others that are reading along. So let's talk about some of the functional markers and even standard conventional markers that are available to start asking these deeper questions. In terms of conventional labs, something to ask your practitioners for are to look at deeper hormone signaling when it comes to blood sugar. One in particular that's super easy to tack on to a test is fasting insulin. You've likely had your fasting glucose and HbA1c tested again and again, but even those markers change far too late in the game. Fasting insulin tends to change years or even decades before it starts to reflect in glucose and HbA1c. One of my favorite functional tests to get insight into not only blood sugar handling, but mitochondrial function at large is the organic acids test, or OAT. This is a test that looks at the chemical reactions involved in energy production and looks at a single urine sample for roadblocks that are occurring in that chemistry. Essentially, when there are roadblocks, it will spill over into your urine in higher amounts. But to be clear, these markers don't provide a diagnosis in the conventional sense. What they do is give us a reading on where you fall on that spectrum of function to dysfunction. Fundamentally different perspectives, but very useful information. These markers that show mitochondrial stress or inefficiency can indicate that the cell is under additional load or burden, even when your standard labs reflect nothing. So another thing to take away from this is mitochondrial dysfunction before disease is not some niche clinical curiosity. The effects of mitochondrial dysfunction, whether it's poor blood sugar regulation or poor fat burning in the muscle tissue, or a shift toward less efficient energy production, these are all connected to the upstream drivers of type 2 diabetes, cardiovascular health risk, and metabolic syndrome, and many other chronic conditions. This is not a dramatic claim either, but a well-established underlying mechanism of these conditions. What's so important to understand in this too is the same things that affect your mitochondria may be different than even your twin brothers. It's important to find out what's actually driving mitochondria in the direction of less efficient energy production in each specific person's case. I always tell my patients that we are a sum of our lived experiences, and each one of us obviously has different lived experiences that add up and reflect on these deeper lines of questioning and labs. If any of this reflects where you are in your health or healing journey, and you have a curiosity about how your mitochondria are functioning or similar lines of questioning, watch the free training below. It gives you a bit more information about my approach to functional medicine. And if you're in one of the states that I practice in, feel free to book a health mystery map call. I'd love to get my eyes on your case and see if it's a good fit. After understanding this gray zone of mitochondrial dysfunction, what we didn't talk about was what's actually driving mitochondria into decline in the first place, because the answer to that question varies significantly person to person, and that's exactly what I go over in this video here. So check it out. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.